PMHNP at npexamcoach.com. I'll
Oh,
go ahead this into the Google chat box. See if you guys can see it there. PMHNP at npexamcoach.com. All questions, always email us because we'll be able to help you guys better. So today it's a much, sometimes I do one-on-ones. One-on-ones, it's very difficult for me to do it because it is takes a lot of time, and we do a lot, provide a lot of time. But sometimes I'm able to accommodate, but not very often, right? So today I'm going to do a little bit more of a one-on-one with you, but in group. So I ask you to, if I call your name a bit uncomfortable, go ahead, try your best to answer the question. If you don't know the answer, just say call a friend and call on pick on somebody else. Does it sound fair? So that way we can get moving. Now, if someone is speaking to the question, please do not interrupt them because that way they can fully um, develop their ideas. And the question is specifically for them, for the person that's answering this specific example. Go ahead, Betty. What is your
yeah, Dr. Lopez, I must commend you, appreciate you for the PDF review book that you gave PDF on it when we passed the section 1, model 1. When you finish model 1, you now give that book, the purple book that you give as a gift. Very
yeah?
helpful because you can read it anywhere in the car, on duty, anywhere you can read it. It's very helpful. I appreciate you for that. Thank you.
So yeah, actually, you just brought a very important point that I actually don't talk much about it. So since you mentioned that, I want to actually highlight that because I should have done a better job explaining one of the highest benefit of the course that people are not using it, and it's my fault. Let me show you exactly what I'm talking about. So I pay tons of money, like unbelievable amount of money, to create this too, and I'm not even emphasizing. So I want to go back to it right now, and then kind of talk about it a little bit. So let's say I'll show you my screen in a second. Let's say I don't know. Let me share my screen, and I want to show this awesome tool that I should have specified a little bit more about it that we have, that it can answer any question that you have. Almost. I can almost guarantee you. So let me share my screen here. It's like you don't need me at all. You have a system here that can answer any question. So let's say this is the beginning of module 1, and it's about cerebrum, right? You have the video here. I want you to imagine that. Perfect. Got it. Under the first video of each module, you have your PDF. But guess what? What else you have here? This thing here, um, let's say, let's see here. Sorry. Ask the robot any question. So do you see where I went? Here, can you see my screen?
Hmm? Yes, we can.
I'm seeing your screen, but
So,
I'm not seeing your mouse, what you are doing.
so do you see on the upper portion of the screen?
I see your
Yes.
mouse.
I have this tool that unbelievable. So let me ask this guy here any question. What is lithium levels? Simple questions, right? Let's see what if the robot will be able to answer. Guess what? Okay. So it just gives you an answer. It says normal lithium level ranges from 0.5 to 1.2. Toxicity occurs when they reach 1.5 or higher.
Mm.
it is crucial to understand that the levels to ensure the safety and effect. Ask any question. So tell me about
TSH.
lithium. Sure. Tell me about TSH. So tell me about TSH. Just general. Okay. I spent a fortune on this. Okay. A fortune to create this for you. And I probably didn't do a good job in explaining this to you, right? But anything that I teach, anything that's a PDF, it learns it from me and kind of would answer the same answer that I would give it to you because it learns from me for years.
Awesome.
So actually, it went above and beyond and says, hey, the TSA, what is TSA? Thyroid stimulating hormone, right? It's a pituitary gland in the brain. If I said it that it was there, if I said that it was a pituitary gland in my feet, it would have said that to you because it records me and learns from what I said in the past. It could be, don't take it for granted that everything's going to be 100% correct, but it learns from what I said before.
Like
so the
AI.
TSH levels are important in assessing the thyroid function. When the TSH levels are low, and I say this all the time, when the TSH levels are low and the T4 are high, it indicates what? Hyperthyroidism. On the other hand, when the TSH are high and the T3, 3, 4 are low, it indicates hypothyroidism. So remember, TSH levels should typically fall between 0.5 to 5. I mean, this is an incredible tool that I actually feel ashamed for not have, because so many things are happening. So many things. I'm trying to give you all. And I created this tool and they spent tons of money getting that for you. So what questions? Let's say, tell me about, let's see. So tell me about
Yeah, because I've been in
Carl
all the videos.
Roger. Tell me about Carl Roger. Anything you can ask, right? It should give me something. Carl Roger was a prominent figure in the field of psychology, known for development of humanistic therapy. He believes in the importance of a person-centered in therapy, focus on an individual potential for what? What I say all the time, growth and self-actualization. Rogers emphasized the significance of therapies, the therapist providing support and empathy, empathetic environment. Remember, he doesn't even take notes. Those that follow those therapies, right? His therapy approach is often referred as person-centered therapy, highlighting the belief that every individual that has the capacity to lead a fulfilling life. This is exactly what I said somewhere, somehow, but it's there for you. So
That's
let's say,
amazing.
tell me about
Yalom.
Yalom. Tell them about Yalom. Oh, so is that right?
I think it's
YALOM.
YALN. Yalom group
M,
yeah,
not N.
M group therapy. Therapy. Okay. Sorry, my eyes are falling here too. So let's see if it says anything about this guy here. Okay. Here, look, it said I heal soccer.
Oh wow!
Anything I ever said in my life, I record myself in my dreams and I talk to myself all the time. I'm not crazy, but I do it so that if I said something and you ask me a question, I'm not there for you, it can give you the answers. So tell me about what does I heal soccer? I don't know if they would say that. That's kind of very specific, right? I say that's
Like
super specific. Let's say, what does it mean?
yeah, define he suck. I heal soccer.
It mean, right? Let's say I will even make it. Let's say if I'll break it down the 10 principles that we covered yesterday, right? Well, it didn't. Oh yeah, it did.
It
See,
did,
it did.
Oh my God! Look at that.
Dr. Lucas, can
So
you see how you got there? I wasn't able to see
yes,
how you got to
yeah,
this.
yeah,
Well, this is
absolutely. So
amazing.
yeah, so in under any video, you have questions here. You can ask a question, like if you want to message me. I don't recommend that because, again, I have
Um,
20 different social medias. I may not get to you.
And
Okay.
where
You
are you?
can
Are
have,
you
What
you
of
can
the
do a
experiencing
video?
search. You can
this
do a
is like
search
this
Dr.
is in the
Lopez,
module.
where do you get this video? Is it on
In the
which of,
modules.
in the
The 30
modules.
days.
in the modules on the online?
Yeah,
Like
when
Yeah.
you're doing the modules on the top right, it has those options with the circle. It looks like a with
yeah, I
the
saw the
So,
software.
glass
I'm
and the
wondering
bell.
how did he get to the module? So because I'm brand new, I'm
Oh,
oh,
I'm
seeing
so sorry.
probably a link.
So here we go. I because I have a different screen, I cannot may not be able to show you exactly how to do that. So you get to the modules, you receive an email from me, and it says
yes.
I even tried to make it easy on you. I called something magic link. So because I have trouble remember my passwords, I don't want to remember another password. Once you
Okay.
log in with your magic link, it knows where you stopped last.
Okay.
So every time it will start where you stopped left, right? So I don't recommend you do this here, all trainings, because if you do all trainings, then I'm going to overwhelm you with 100 different trainings, right? So all this is in a course for you. So you have scientific foundation. If I click scientific found, I don't recommend this because this is going to overwhelm you. Now I have 23 videos under scientific foundations here, right? Everything we covered. Let's say carbamazepine, and then you have it here. Remember, now I don't have a PDF here, right? PDF is only on the first video of each module, but your robot is here. You can talk to this guy and ask him any questions you want. As
Okay.
long as I talked about it ever, it will be here.
Mhm.
Somehow it will be here. So this is a tool that I didn't really talk about a lot. Maybe I should have, but
No,
another
it's
thing
beautiful.
is we have our community forum, right? So here, oh, I don't know what happened.
Which
here.
icon at the top did you pick?
It's
That's what I'm saying.
the square one, not the circle.
So
The
there is the bell
Oh, okay.
to the left of the bell.
left of the bell. Let me see.
Yeah, it's like almost a question.
It's like
I mean,
a TV
yeah,
screen.
this is like highest
Hmm.
technology I could ever put into a course, right? I mean, it's like having me next to you the entire time, 24 hours a day.
It's like
If I ever said something,
like an AI.
Yeah.
Alex Lopez.
yeah, he is like my AI, right? So everything that we talked about is here. It learns from me. Everything that I said is for me. Now, it could be that it will give you the wrong answer, right? So don't kill me if it does, because it's always a thing that's learning and redefining, and every month we get better, better, and better. But this has been on for 2 years now. I've been working on this for 2 years on this robot. Like I record myself, I talk to myself, I send videos, I send books, I send my notes. So it kind of learns from me, and you can have it. It's like having me next to you the entire time. Any questions that I ever talked about, even if it's an incomplete question, should give you an answer. Now, let me see if I can go to the community. It's not allowing me to go in the community. I don't know
It
why.
did. I just
Maybe-
tried it. Yeah.
Okay, I don't know why, but remember that if you go all trainings, it's gonna show you all the trainings. This is gonna be overwhelming, right? Because I have over 100 trainings there for you. I prefer that you go one training at a time, one thing at a time, so you can give you 100% focus. But let's say you have completed the course and you just want to go for one specific topic, one specific lecture number 22 of module 4 that we covered yesterday. So you go module 4, and then you should be able to go specifically to the lecture that you'd like to review right now, because you're like, yeah, I looked at my PDF, I know what this lecture is, I just want to hear what he said here. And then you can go specifically to, let's say, eye movement therapy, and then you have it. So the live is great, but the entire course can be done at the comfort of your home without being live. Now, when you come to the live, obviously, guys, now we are moving on to eye movement. So the live, I would hope there will be a second um, pass through the subject. I would hope that you have gone through the modules. Obviously, some people joining us today. Thank you for being here, and I get it. But going forward, if your schedule allows you, I would start at module 1. Next week we'll do module 5. But try as you catch up, try to already have gone through this, because when it comes live, it will be a second pass. It will be a second way of saying the same thing. Maybe some intonation of voice, maybe emphasize, maybe I'll learn something from you, maybe a different acronym, right? But primarily, everything is here. You don't even need to go to the live course, especially with this robot available to you. Now, no live trainings will ever be the same, right? So now let's say, oh, okay, I missed the live trainings and I really want to see a live training that happened in the past. There is module 11 here. That is a pre-recorded trainings out of the past, right? So module 8, module 11. You can go to the live training and be like, oh, okay, look at that. We have module 1, part 1, blah, 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 blah. So all this is extra stuff that I put in for you there, right? You have some, even the crash course review live, right? So spending time here is how I know whether you will pass or not. Now, let's talk about one very important thing, which is module 8. Module 8 is your diagnostic test, right? So module 8, you should only take this test 10 days, 7 days before your real test. But take that as if it is the real test, as if you're preparing that date for the real test. Because if you score 80 on the first time, it's very, very, very strong indication that you will blow the waters. When you don't score and you score 70, I am in offense now, because I don't want you to. I want to count for anxiety. I want to count for weather, breaking car tires, or something that may cause you to be a little bit uneasy during the test date. So I want you to blow this test without any kind of hiccups. So I want you to score an 80. So if you say your test is on the 30th, in your mind, your test should be on the 20th. And on the 20th, you should take the diagnostic test number 2. Diagnostic test number 1 is a pre-test. When you first come in, you'll be like, oh, I took this, I scored 55, 60. So now I mentally know that I need some help and I need to do some work. And then you're going to retest again on module 7. And then we're going to test it differently, in a different way, on module 8 to make sure that you are 100% good to go. Okay? So when, one quick second, my dear, please. Live classes, I sent an email with your schedule. So you know live classes. I'll be maybe adding a little bit more. Add to it. I want to do the the crash course review more times. Less than 6 hours is crazy for you guys. It's very painful. So maybe I want to do maybe 3 small crash course reviews of 3 hours, maybe 2.5 hours, so I can give you more content and less tiring on you guys. So I'm always looking for ways to improve. And if you find something that helps me improve, please tell me, because I want to improve more and do more and be more for you. Okay, so please ask your question.
Dr. Lopez, I'm sorry. While you're on that note, I was looking on my phone and I couldn't see what the AI bot is. Can you show me one more time?
I sure can. See this bell here? My eyes are bad. See this bell here on the right upper corner?
It's those four gray circles.
Yeah. It's not the bell. It's the one right next to it.
The little blue logo?
The blue. So then next to it, you have a bell.
Yeah, see the
and
bell.
then next to it is the boat.
Search. Okay, search.
Yeah.
Oh, okay.
It looks like search. I would call it search, but it's not quite a search because this is a search. I
No,
think.
it's not the search
oh,
circle.
Yeah.
Yeah.
This is the search, right? So you can search
Okay.
for whatever you want to search in the course. But here next to the search, right?
Yeah, I got it.
Then you can ask any question that now please be mindful, don't take it 100% as accurate, right? This is might take years to get. I think is 95%, 99% correct, I would say. But I still don't want you to think that's absolutely truth because I don't hold the absolutely truth about anything in life, right?
I have a relevant question based on
Sure.
that because I just asked it, and this was a question that I was going to say for the end. And I know I really appreciate everyone else dealing with me, interrupting everyone. Thank you so much for my interrupting attitude. It's just the way I was raised. But I asked this AI bot, does VPA lower or raise the seizure threshold? And it's telling me after I asked that, VPA, also known as valproic acid, lowers the seizure threshold. This means that it makes it easier for seizures to occur. Now, my understanding of VPA was that it raised it. Now, I don't know. I want to hear your answer, though.
Yeah, you're right. But ask the boat, how does valproic acid helps with seizures? Maybe it was the question, the way it was asked, whether it's lowering, because that's not a good terminology, whether lowers or raise, right? So you can ask, how does alcohol withdrawal affects the seizures? There'll be more precise question. So it also depends how the question is asked, right? If it's very informal, if it lowers or increases, it could give you a wrong answer. But ask, how does valproic acid interacts with seizures, and see what it says.
Does valproic acid raise?
Not raise.
How
How
about
does
raise?
it? Yeah, because raise, lower, it's pretty ambiguous, right? How does it interact with seizure? What's something along those lines, but more specific. And let's see what it says.
Okay. How does VPA react?
We can ask, well, what's the goal of it in relation to seizures? Something like more concrete.
Can it do? Well, I want to hear from you. Can it do both, or is it something?
No, it's supposed to be for seizure prevention. So it's an anti-epileptic, right? Or a mood stabilizer, more precisely, right? Here we're using for mood stabilization. So now, as far as I say a lot, a lower and decrease the seizure threshold, that has to do a lot with alcohol withdrawal, right? Alcohol withdrawal lowers the seizure threshold. So it wouldn't be a correct terminology to say that valproic acid lowers the seizure threshold. So, all right.
Yeah.
So that's what I want to ask. But if you have a that's the answer that said that of Rebecca.
It said that again. How does VPA react with seizures? VPA, known as valproic acid, lowers the seizure threshold. This means that it makes it easier for seizures to occur.
No, yeah, it's not correct, right? Rebecca, what you got there?
If you lower the seizure threshold, you prevent seizures. If you raise seizure threshold, you bring them on.
I thought it's the opposite.
That's what I'm trying to clarify.
Yes, so it is incorrect. Is the other way around, right? So if you're lowering, it's happening more often.
Right.
So and this is the question is a bit weird because here we use valproic acid, never for seizure prevention, right? We're using this for mood stabilization. In our field, we're not doing this for preventing seizure. The only time that not the only time, but the one that specific example that I give all the time, it's how does alcohol withdrawal interact with seizure. So it lowers the seizure threshold.
Or the other one is Wellbutrin too.
Wellbutrin too. Yep.
Oh, the seizure
Wellbutrin as well. Right. That's why we don't prescribe Wellbutrin for someone with history of seizures. Okay, because it could lower the. Anyways, so I just wanted to kind of say a little bit more about this tool that's available. It could be that they also could give you an incorrect answer every once in a while. So take it with a 90% credibility. But if you see that something that weird, let me know. Then I can look where I said that or what happened. But it's a new way of learning, right? So we are finding better ways, we are working on them to deliver to you so you can get better and better and better. Now,
I think
so
it's brilliant. I never found this before. I think it's wonderful, brilliant.
yeah, well, thank you, appreciate it. So yeah, so that being said, I don't want to take a whole lot of time on the course. I wanted this to be more about you, all about you. So what I will do now is play an interactive game in a different way, right? So if you're uncomfortable, just say call a friend and pick somebody else. Okay. So I'm going to start
Okay.
with Betty. Betty.
Call a friend and pick
do you
somebody else.
Do you have a specific topic?
It'll be all things in life.
Everything. Okay.
Yes, what did you
Okay.
say?
So I'm going to start with Betty because I got to pick on Betty a lot today, just because she's testing soon. So I got to make sure that I'm focused on Betty. So 1 second here. Okay. So
Okay.
it'll be unorganized, whatever comes to your mind. Okay. So, and
Okay.
this is how you really know if you know things or not. So tell me the onset age of schizophrenia for males and females. Only Betty, please. Okay.
For
And if she
male-
doesn't know, she'll call somebody.
For males, 18 to 25.
Females.
Females, 20 to 35. 20,
All right.
20 to 30.
So a weird question. I don't even know how to ask that. Tell me the hallmark of schizophrenia. Well, let's talk about schizophrenia. Let's talk about the dopamine pathway. Tell me about the mesolimbic pathway. What happens there?
The mesolimbic
schizophrenia,
pathway.
yes.
The mesolimbic pathway is the hallmark for positive sign because there is increase of dopamine in the
Okay.
dopamine pathway.
So I'm going to interrupt you guys because I want to keep going. I don't want to. It's going to be fast. So tell me about the mesocortical pathway.
The mesocortical pathway is that there is a decrease in dopamine causing negative symptoms.
Give me the negative symptoms.
Negative symptoms. I'll go here.
Okay, perfect. So anything that starts with an A.
The
Any
allegoria,
words that-
allegoria,
Perfect.
Allegoria.
anhedonia.
So you know for the test all the words that
All the
start
A's.
with an A. Okay, like I said, I'm gonna have to interrupt you because we gotta keep on going. So tell me about the Niagara striatal pathway. What
The
happened?
Niagara striatal pathway is the I think is the motor center kind of. It's a decrease.
Motor
in,
symptom.
yeah,
decrease
causing
in
motor
what?
symptoms, a decrease in dopamine blockage causes an increase in acetylcholine.
Perfect. When you have increase in acetylcholine, what happens?
You have this cholinergic symptoms like tears, excessive salivation, and then you movement, the motor movement,
Okay.
pseudo-Parkinsonia.
Perfect. So now we have the last one, the tubular fundibular. What happens in the tubular fundibular pathway?
Fundibular is that when you block the dopamine pathway, there is an increase in prolactin, which could cause galactorrhea, gynecomastia, and if it prolongs, it can cause that is the one that is causing milk, excessive milk excretion, and that can cause osteoporosis
All right, you got it. Well done. Now let me get the question that's related to that, but not really. So let's say a 13 years old boy that says, "Hey, my breast is bigger than my sister. Everybody's making fun of me. What should you do?"
It's a normal phenomenon because it will go.
Okay, perfect. Now, as far as schizophrenia and proverb interpretation, tell me an example.
Like
I'm
if you say those who live in glass houses should not throw stones.
Okay,
If,
so tell me that's good. I have to be fast because this is rapid, right? So I don't want to. I'm not trying to be rude, but tell me few of the etiologies related to schizophrenia. Why does it happen? Like postulated, right? Why would that be?
talk of deregulation of the neurotransmitter dopamine.
Well, yeah, but I'm talking about more intrauterine, so in the
Okay.
mother's belly. So why would that be? What would that?
What intrauterine insult,
Sure.
low oxygen,
Okay.
hypoxia, viral
Hmm.
infection,
Perfect.
um,
Malnutrition. We also
malnutrition,
call the it can be bacteria, but also
bacteria.
we can think what we think about the pruning of the synapse, right? Pruning of the synapse could be one of the reasons. Okay, excellent. Well done. Okay, so if we talked about what's the difference between first generation, generation antipsychotics, what's the main difference, right?
First generation is that they are dopamine antagonists. They block dopamine, the pathway to block the receptor so that the increase in the synaptic clef, there'll be an increase. So they attack dopamine receptors, while the second generation, they modulate both dopamine and serotonin, making it a little bit, making the symptoms, side effects to be less than the first generation.
Okay, so what's the receptor name for serotonin?
The serotonin is 5H2.
5H2.
Perfect. Okay. Now, if you put someone with schizophrenia in the MRI, so what kind of change would you see in their brain?
MRI. Oh,
Yes.
the structures. You have a large ventricle.
Perfect. That's all. Everything else will be kind of decreased. So we kind of
Decrease.
keep on
Every other
moving,
thing is
right?
decreased.
So
Ventricles are enlarged.
hippocampal, amygdala will be all
Decrease.
decreased. Okay. So now let's talk about schizophrenia and some medication. Haloperidol. Let's say you want to switch someone from haloperidol. Say it's taking 5 milligrams BID, and you want to switch to a depot injection. How would you do it?
BID that is taking it twice, 5 milligrams twice a day, and
So that'll be 10. Then what do you
10
do?
times 20
Okay,
times
that's
20,
200.
then that's 200. So you would give 100 milligram initially, then after 5 to 7 days, you give the rest 100
So
milligrams.
you give 100 at one time, and then you wait for the rest, right?
Yes, yes.
So everybody understand that that's 5 milligrams BID. So that means 10 per day, and then you multiply to 20, you got 200. Then you only give 100 for the first time, and then you wait to give more, because now clinically, never ever any medication don't give an injection before you try the pill, right? Because guess what? If they have an
Adverse effects.
side effect, or kind of blanking out, if they have
Allergic
a
reaction.
rejection, yeah. So thank you for that. You don't want them to be stuck with that medication. And guess what? I see doctors doing this all the time, especially with what? Vivitrol. They start the patient on Vivitrol right away, and they want to kill him. I'm like, why are you doing this? Oh yeah, I forgot. Well, can't, right? Because now if someone's allergic reaction to Vivitrol, now they are stuck with the Vivitrol for 4 weeks. You want to intubate the guy for 4 weeks? No, we don't, right? So please.
It's short
You have-
mnemonic. EO before depot. EO before depot.
Okay.
Easy to remember.
All right. So perfect. Thanks for that. Tell me about a sort of community therapy. What is it and who is for?
Huh?
ACT.
ACT is for, it's like a rehabilitation for schizophrenic patients.
Or bipolar patients, or those that
Bipolar
need.
patients,
What's the premise behind that? Why do we do it?
the easy access to
Resource.
the treatment, and then treatment resistance is easier for
Okay.
them to be treatment resistant patients.
Okay. And the premise here is that we
And
want
then-
them in the community, not back in the hospital.
Yeah, to
Okay.
reduce frequent hospitalization.
Okay. So perfect. Can you tell me what is schizoaffective disorder?
Schizoaffective disorder. Schizoaffective disorder is a disorder that is similar to schizophrenia. It has similar symptoms with schizophrenia, but it's less. It's 0 to like 5 months, not up to 6 months.
No, that's the
Oh,
schizoform.
that's schizoform. Yes.
Okay, so schizoaffective,
Yes.
affective, think of a face, so like it's not true, right? But you affect, and that reminds you of a depression, right?
Mood
Mania.
disorder.
So
Mania.
yeah, mood disorders. Thank you. Not even perfect mood disorder. So schizoaffective. So characterized by a combination of hallucination, delusion, and affective, the mood, right? So just be mindful of that.
Mm.
All right, so somebody else, I picked enough on you, so let me see something, another question here. Thank you, good job, well done. You're on point to pass the test. You were able to spit it out, so you're good. That
Thank you, sir. But I appreciate that book. I can read it
Yes.
anywhere.
Yes, so that's good. Let me see. If you this one's hard, so anyone that can speak to this, anyone, because this one's kind of odd, right? If you say hypnagogic, HYPNAGOGIG, hypnagogic hallucination. What does it mean?
So
When
that
you
means
sleep, when you are
that's a
about to
hallucination
sleep.
when you're waking up. Yeah, while
Perfect.
you're
Yeah.
awake.
Yeah,
Bonus
sometimes
is when
I
you are
feel
sleeping.
sometimes I feel that I get that at times. So they happens during
sleep.
transition between wakefulness to sleep, right? They may involve seeing, hearing, or feeling things that aren't really there. So person might hear something calling their name, or not necessarily. It's a transitioning from awake to sleep. So think of going to sleep with a G, right? If that helps. You
Yes.
can also get a hypnagogic
Pumping.
Pumping.
hallucination, which is the waking up during the transition, right?
Yes.
Think of a pumping out of sleep.
Mhm.
Now, one that people get wrong all the time, and they just can't take it because it's so easy. Thought process versus thought content. Let me see somebody else. Don't blow it up. Let's go, Sandy. Can you help me here, please? Thought process. Do you remember what that is?
Okay, so third process is a disorganization of speech with
Perfect.
the thought process, but thought
Process.
content.
Okay, so
process.
process. Let's go process first.
Okay, I remember disorganization of speech with the thought process. What else with the thought process?
Give me
But
two
I-
examples of that.
process. That's not the attention and concentration, is it?
No.
Potentiality and circumstantiality.
Circumstantial.
I'm so
What
sorry. Yes, circumstantial and
what does
tangentiality.
it mean?
So tangentiality is just going around in circle, but getting to the circumstantial is going around, but getting to the point.
Okay, so let's make that very clear. Circumstantial, I'm going around and around and around. Eventually, I answer the question. Potentiality, I go around and go away. Never answer the question.
Yes.
Okay. Now,
Yeah.
thought content, what does it mean?
Third content is their content of thoughts, such as homicidal thoughts, suicidal thoughts, and
Perfect.
everything else.
Okay, hallucination, auditory. Yes, you're absolutely good, right? So, what does insight mean? Patient's
Insight.
insight.
Insight. So
Yeah.
insight is
Do they appear to have insight or not? Right?
yes, insight about their disease process.
Yes.
Yes.
So basically, or they, if I say they are depressed, they say yes. Well, they would say to you, yeah, I'm depressed. So they have insight of their condition, right?
Yes. Yes.
So do they believe to have a mental health condition? Yeah. What is judgment?
Judgment.
Because it's similar to insight. If I drop a letter on the ground and it's next to a mailbox, what would you do with that letter? So it's a judgment. So ability of the patient to make sound decisions, right? Evaluate decisions and anticipate the consequence of their actions, a norm, culture, values, or personal goal. So judgment, it's having good judgment, right? A normal person will pick it up the letter and put it in the mailbox, right? If you got a stamp on it. So just the insight is how do they see it, and judgment is more like how they would judge a condition or do what would be expected. Like, would you do if you found a wallet on the street, right? All right. Tell me about the clock drawing test. What do you remember about it?
Clock drawing test. I know it's a test that we use for patients that have schizophrenia to determine is it signs of Alzheimer's?
Okay. So not necessarily schizophrenia, but you're not incorrect either, right? You're not incorrect. But if you think about the clock drawing test, I want you to say fast. It's 2 minutes, can be done in 2 minutes. It's a test that assess Alzheimer's in dementias, right? So it's cognitive, neurological signs, right? And the brain part, it would be anyone. What brain part would be affected if the clock is parietal lobe, right? So that's high yield. Now, also here, there is something called constructional apraxia, right? Which is the inability or difficult to build, assemble, or draw object. So constructional apraxia is I cannot build things on top of each other. I cannot draw things, right? So that goes along with not being able to draw a clock. Constructional apraxia means that can be caused by lesions in the parietal lobe following a stroke, things of those natures, right? And then as you see them with Alzheimer's and dementia, right? All right, let me pick on somebody else here. Rebecca. Rebecca, what can you tell me about the mini mental status exam? What's another name for that?
Holstein.
Holstein. Okay. What does the mini mental status examination assess for?
The mini mental status exam is best used to identify long-term cognitive changes.
Okay. What does scales goes from 0 to what?
I don't know.
Okay, 0 to 30.
30.
Is 30 good or bad?
Normal.
24 to 30 is normal.
24
Okay,
to
so
30 is
24 to
normal.
30. Okay. So basically, the slum and the mini mental status examination, the Folsom test, high numbers are good, which is different than other scales. Other scales, I don't necessarily want to have high numbers. I want low numbers, right? So 24, 25, we're not going to split hair here, right? But 24, 25 is usually considered normal. Right?
Miss Beck, Mrs. Beck, your grandmother said.
That's it. Yeah.
I used to your
Right.
grandmother said, Miss Beck, 1928. Then
1929.
29. Yes.
1929. Then she went to do HPVP, HPQ, and it's 10 to 14.
GAD.
She went to do GAD 10 to 14.
Love it.
Then she's
Yeah.
now going to do she's now going to do Hamdi. And
14 to
MD,
18.
Ham A,
18 to
right?
24. And then she now wants to do Ham A. It got 24, 18 to 24. Yes.
So
I just use
guys, if you are new today, so thank you for doing that. Don't feel flustered. Okay, they already have gone through the course and they
Yes.
kind of memorize those crazy ways of things that I say at times, but it helps. So if you're like, what is going on? You know, my grandback was born in 1929, and I'm not going to go over this right now. I just want to hold off a little bit because you will see that coming up. Okay, it may not make sense now, and it's not supposed to, but eventually you'll see that, and she got it. So thank you for doing that. Now let's see, Rebecca, do you remember if I test MMSC and I'm testing for concentration, what kind of test would I do?
Attention calculation.
07s.
Registration.
Yeah, just let her answer, guys, because I'm gonna pick on
so
everyone
world
here, right?
I'm
Yeah,
sorry.
so word backward, series of 7 that all do concentration, attention, calculation. Okay, so now a very, very important one just for her. Okay, very important. Tell me the difference between registration and recall.
Recall is to remember 3 objects you ask them about. Short.
After
and
how
then
long?
longer.
5 minutes.
After
Immediately and after 5 minutes.
okay, so immediately would be registration, right? Immediately, as far as registrations, tell me what this is, and this is. That's registration, right? So within a minute, I say, hey, now recall is after 5 minutes,
5
right?
minutes.
Well, within 5 minutes. So not splitting hair here, but okay. So tell me an example of fund of knowledge.
Who is the president?
President.
Okay, so very good. If I say stereogonastic, ooh, that's a hard one. Stereogonastic. So,
You identify an object in your hand without looking at it.
ooh, that's good. So if
Mhm.
I say this is a key, and I close my eyes, I think I would be able to say this is a key, right? So yeah, stereogonasis testing assess the integrity of the sensory pathways and processing the brain, particularly in the parietal lobe, right? Because remember, the parietal lobe is all about sensory, which plays a role in the sensosomatic, somatosensory perception, right? Now let's talk about that perception. If I close my eyes and I'm not able to have a balance, what part of the brain would that be most likely be affected?
Cerebellum.
Cerebellum.
Cerebellum. Okay, so very good. Um, okay, let's move on because we do have quite a bit to cover. So who's testing soon? Other than Betty, anybody else testing very soon? No. Okay. Let's pick somebody else.
What do you consider soon?
I was gonna pick you, Albany.
Oh.
Anyways, so I was looking at your name right now. You're it. Okay. So tell me about the relationship between olanzapine and smoking. Why do I care? Just her, guys. So
So
if I even care.
okay, so if a person is smoking and they're on olanzapine, you have to decrease the dose.
Okay.
And,
Well, okay.
and
Let her say it, guys, please.
you have to increase the dose, and then once they stop smoking, you have to decrease the dose because
Perfect.
it's
Okay.
a inhibitor.
Okay. So let's go ahead and recap that, right? So you told me that if you're smoking, I have to give a higher dose. Is that right?
Yes.
Okay. If they stop it, John come back to you and say, hey, Albany, I'm kind of, I told you Albany, but Ebony, right? If I stop smoking, then what would you do?
You have to decrease the dose.
Okay. Now, what the medication is doing to, what smoking is doing to the medication if I have to give more? Does it retaining or is kind of taking outside the body?
It's decreasing the amount.
Okay. So that means I would need more medication, right?
Right.
So the enzymes inhibitors can increase. Well, hold on. You can hold on a second. So
That's wrong. That's wrong.
so the enzyme. So let's talk about let's away from that for a sec. So if it inhibits, that means it could cause toxicity, right? If it induces, I need more of the medication, and that could not reach a therapeutic levels, right?
So smoking is an inducer.
Yes, smoke is an inducer because now I need more of the medication to achieve a therapeutic level. Now they stopped smoking. Now I need to decrease the medication to achieve a therapeutic level. Okay, good job. Now let's think about enzymes inhibitors can increase the level of the drug that are of the substrates, right? So possibly causing toxicity because it's inhibiting the drug. So now let's talk about lamictal, Depakote, or significant interaction. They do, especially carbamazepine. Valproic acid is an inhibitor, meaning that it inhibits metabolic of what medication jumps right at me when I say valproic acid and X, Y, and Z med, leading to an increase in this medication a lot. Anything you can think of. This is hard and odd, right?
It's either Tegretol or Lamictal. I don't know which one.
Perfect. Well done. Lamictal, right? So if you mix valproic acid and Lamictal, you better be, and I do all the time, right? But you got be very careful with the Lamictal dose because the Lamictal dose will increase almost to 100%. I'm throwing this out there. It's not really 100%, right? But be very careful. Now, if you prescribe someone clinically here, this is not for the test. If you prescribe someone with Lamictal, how would you do it? What are you concerned of?
Steve,
Go ahead. Just herpes, please. We moved Steven Johnson syndrome. What is the other medication that you'd be concerned with Steven Johnson syndrome?
Tegretol.
Tegretol. Okay. Oh yeah, Tegretol, carbamazepine, right? And now, to which population would you be concerned with carbamazepine?
Asian.
The Asian.
Asian population. Which lab would you collect in order to know if would you prescribe carbamazepine or not?
H lab 1502.
Okay, perfect. Now let's move on to somebody else. Is anybody else testing soon before I pick anybody else? Okay. Alicia, I don't know. Would you be able to answer maybe one or two questions?
yes.
Okay, so if we think about a lot of people making mistakes here, right? And well, let me dial back a little bit. The problem is that our minds as the students, we go to inhibitors and inducers and which neurotransmitter is involved here, because it's like, it kind of seems to be the buzzword. But at times, it's not about inhibitors and inducers. So everyone, please pay attention here. So sometimes it's about another medication that cause mania. And it's not because it's inducers or inhibitors. Let's say
Steroids.
Let's say I prescribed dexamethasone. Oh, no, not dexamethasone. I'm sorry. Prednisone. Dexamethasone or prednisone. That medication is not an inhibitor or inducer in itself, but is a medication that could cause what, Alicia?
Mania and depression.
Mania and depression. So if that's the case, what is your action here?
To increase the other medication, so the person won't.
Your medication, right?
They like if it was olanzapine, and you mean like that.
Perfect. Yeah. Yeah.
You want to increase the antipsychotic or the antidepressant.
Perfect. Yes. I love that. That's probably the right answer. The second answer would be talking to collaborating. Yes, I will repeat that. The second answer could be collaborating with the physician to know how long they're going to stay on this dose and so forth. But the most likely answer is exactly what you said, is that increase your dose. It's not because prednisone is an inhibitor or inducer. I just pick an example here. It's because that medication could cause mania, and that was the reason someone else just destabilized your patient. Okay.
Right.
So I'm going to repeat this because it's a critical mistake that almost everyone makes it. When you have someone that's stabilized on your medication, usually the question say the bench stabilized on that medication, and recently had an infection, and the doctor prescribed prednisone. It will never say steroids. It will say it's up to you. I teach steroids. It's up to you to know that prednisone is steroids. It's up to you to know that dexamethasone is a steroid, right?
Yes.
And then it asks you, now the patient became manic. And then answer A, it will say, I'll put this right on A because A is usually a catch answer. I would say dexamethasone is an inducer causing your causing your olanzapine to be less effective. That's not the premise here. The premise is that the answer would have been because prednisone is a medication that could cause mania, and that would complement with you have to increase your olanzapine. Clear, everyone? All right. So, can you tell me we talked about prednisone? Can you tell me about any other medication that could cause mania? Out of it, I know it's odd. So if you don't, you can call a friend. That's fine. Just wait for her, please.
Mania and depression. You got steroids. You got INH. Is it INH?
Yeah, INH.
You got
isoniazid, right? So INH, yes. What else?
got antidepressants.
Yes, antidepressant can cause mania. Yes.
And
Anti-abuse, right?
anti-abuse.
Yes. Do you remember any medication that could cause depression?
Yeah. Steroids.
Steroids. What else?
Oh gosh, I can't even think.
All right. Anyone can help her out here for a second?
Beta blockers.
Beta blockers. What else?
The Accutane.
Antiviral.
Accutane. Perfect. So let's stop here for a second. Accutane. What
can cause birth defects?
Perfect. Accutane can cause birth defects. So beta blocker, interferon. That's another one that can cause depression. So my point here is that you need to know your medication that can cause depression and mania, and know that it's not related to inducers and inhibitors all the time. Okay, because I see this every single week. Okay, so be careful. Progesterone will be another one, right? Now let's see somebody else. Let me pick somebody else's name. Nicole, can you answer a few questions for me? If you can't, that's fine. We can call somebody else. Can you tell me some symptoms of mania?
Yeah. So mania, not sleeping, for decreased need of sleep.
Perfect. I love that. I gotta stop that because that was the best way. If you ask your patient if they have insomnia, they say yes. If they're not sleeping, they say yes. In clinical, right? But if you ask exactly what you said, decreased need of sleep, your preceptor is gonna be like, you're good, because that's very different. I could be up all night because I have to do homework or because I have to work, right? It's not because I don't need to. So that was perfect the way you said it. The decreased need of sleep. So please continue that, Nicole.
Pressured speech.
Pressured speech. I gotta stop you there again. So anytime on your charting, This is clinical in life. If you say pressure speech, anyone that's reading that is going to take a mania. So be careful when you say pressure speech. Go ahead. Anything else?
Impulsivity.
Impulsivity. Okay.
Just along with like risky behavior, either
Risky behaviors.
sexual promiscuity.
Yeah. So yesterday, the day before, I had one of our previous students that passed the board. She now started her own business, and she's starting to consider. She has a business in Florida. She has a clinic in Florida, and she called me yesterday and said, "Hey, Dr. Lopez, I have a question." I said, "Okay, what is your question?" And she said, "I'm doing a lot of medications for patients that have drug related issues. I'm considering on starting some stimulant." I said, "Well, you can. It's not prohibitive, but I would not, right?" So the thing is that I said that because we have ADHD, and then you have drug abuse. So if you start on a stimulant, it could be, if you do this for 100 people, 99 of them could benefit. But then one that you prescribe stimulant went on and abused Adderall and crossed the street and got hit by a car. One could make a case that which ethical principle you may have violated. Anyone can remember?
Well, being on the concept, do no harm.
Ooh, she said it. She said, "Nicole, you said it. What is it?"
Non-malfeasance.
Malfeasance.
Beautiful. Malfeasance, right? Beautiful. So that one, a good lawyer could probably make the case for that. You work too hard. And I'm not saying to withhold possible treatment, but we have to be very careful, right? So I loved how you said that, because that is a possible test question. So when we hold the treatment on a basis of not causing harm, that is the ethical principle that we are applying, right? So Nicole, few more questions. What's the difference between bipolar 1 and 2?
So bipolar 1, you have to have a manic episode that cause hospitalization. It doesn't have to have a depressive mood, but you also have the time frame of the decreased need for sleep for up to like over 7 days or something like that, 4 to 7 days.
Okay. All right.
And then bipolar 2, there is no manic episode, but there is a depressive episode that occur, and it does not affect your ability to function effectively in your daily life.
Okay. So I almost agree 100%, but I would put it in a different way. Not to say that you're right, but let me put it in a different way. So bipolar 1, you said it does not require a depressive episode. Absolutely correct. Bipolar 1 means more than 7 days of a manic episode. The one thing that I would take back is just that requires a hospitalization. It could, but it doesn't mean that it needs a hospitalization, right? So the core for bipolar 1 is more than 7 days, and the core is that require manic episode. Now, bipolar 2, it requires more than 4 days of a hypomanic episode. And really, you can call it manic, hypomanic, because it only is manic after 7 days, right? Like, well, not necessarily, but more than 7 days, less than 7. More than 4, less than 7, yes. And it requires a depressive episode. Doesn't have to be congruent. It can be within, the time frame, few months back or so forth. Okay. Now you are right that most, I would say, most CEOs, they may have bipolar 2, right? So they work, and so forth. So it doesn't have to be that severe, right? It's hypomanic, it's not severe, and it does not require, as long as it doesn't pass the 7 days period with those symptoms. Now, be careful in practice when one is a bipolar 1 or 2, you don't label them as a major depressive disorder, because someone else, me, just got this patient with a previous diagnosis of major depressive disorder. I may go ahead and switch them to another antidepressant, and I throw this patient into a manic episode. Now, that being said, let me pick somebody. Thank you, Nicole, very much. You killed it. Let me see. Catherine, please. Why would I prescribe lithium for someone with bipolar? What am I looking for? If you don't want to answer, you can always pick
Standard.
somebody for me.
Is that
Say it
Kathleen?
again?
Kathleen?
Decrease
Yeah.
penalty.
Oh, sorry.
Hold on.
Go
It was a Kathleen James.
Oh, yes.
If-
So
Go ahead.
lithium is neuroprotective.
Neuroprotective.
Yeah.
Okay. So in regards to that, neuroprotective, do you remember another medication that could potentially cause a decrease in suicidality for those with schizophrenia?
Yes, clozapine.
Clozapine. Okay. All right. So can you tell me good example for bipolar depression if I want to use just for the
For
depressive
bipolar
episode?
depression, you can use lorazepam, Latuda.
Lorazepam, Latuda, beautiful one, good. And what else?
You can also use bipolar depression. A good, but no, mania might be valproic acid. Maybe aripiprazole.
Yeah, you can do that too, but I was thinking more of a very powerful one, quetiapine, right? Seroquel.
Oh, Seroquel. Okay, good.
But you're not wrong. It's just a preference. You're not wrong. What is rapid cyclic or rapid cycling?
Rapid cycling is about 4 more manic episodes
Ooh.
within a year.
Perfect. So let's say this way: so it refers to 4 more mood episodes within a year, right?
Yeah.
It's kind of rapid. So those types of patients, you probably don't want to give it a lithium. Not very effective. Yeah, I like to give, if you find that to be it, then valproic acid
Valproic
usually
acid,
is
yeah.
a choice, right?
Mhm.
Anytime you hear mania, manic, bipolar, or OCD, always look at familial history. Okay. That
Yeah.
being said, lithium can cause what type of birth defect?
Extreme anomaly.
Okay.
Low
So you
impact
knowing this information, when you are interviewing a patient and you know they have a murmur, what kind of questions would you ask the patient?
As some, if the mom was on lithium, because
Perfect.
get like a 2 out of 5 murmur aortic.
All right. Sure.
Mhm.
Yes, absolutely. Let's see. What else I want to ask you guys? All right, let's go move on to somebody else. Thank you for jumping in and helping me out here. Let me pick my Google sheet doesn't show me everyone. Oh, let's go, Bina. How are you? So here real quick, or can you answer some questions about borderline personality disorder if you'll be so kind?
Borderline personality people, they don't trust no one.
Trust no one, yeah.
Yeah. So I will tell you one example. One of our patient, her therapist died with a stroke. So then she started crying, upset, no trust, not eating, cutting her hand several times. Suicidality, she was invalid, cutting her hands and feet several times.
Okay. So what therapy are we gonna
we give a DBT,
and
dialectal.
who created DBT?
Marsha Lingham.
Okay. So now I want to actually kind of go back to this because Rebecca asked me this question, I think 1 week or 2 weeks ago. So pharmacological treatment. Remember, Rebecca, that when we did a question and then you were confused or unsure if it was lithium or it was serotonergic SSRI medication. So let's say you want to treat those patients. So to begin with, treatment of choice, dialect low.
Yeah,
Yeah.
DBT.
So it's not pharmacological. But then let's say you do want to go for symptomatic management, right? So if you get those with bipolar disorder, they have irritability, anger, self-harming behavior. What medication would you consider first? So it's very specific here, okay, Rebecca. I know that question that we put on Kahoot wasn't this specific. So I'm saying irritability, anger, and self-harming behavior for bipolar. I mean, not bipolar, borderline. Which medication would be a good choice?
Lithium.
Lithium. Okay, let's stop here. Now, by borderline patient, again, depressed mood, emotional. Remember, Rebecca, when the question said about depressed mood, emotional liability, interpersonal problems, and let's say rejection to rejection to sensitivity. But now I want a mood stabilizer. Which medication would be a good choice?
Atypical antipsychotics.
Seroquel.
Seroquel
Well,
or
hold on. I said I want a mood stabilizer.
Mood stabilizer.
The Mictune.
Sure. I mean, yeah, it could be a mix,
Hypoxia.
but I was looking for Depakote.
Olanzapine.
So hold on, guys, because this one is kind of complicated and it can be it can be several answers. So that's why I want to answer Rebecca's question from last week. So we're looking at 3 medications to start with.
Seroquel.
Well, hold on a second. So we're looking at 3 medications of choice that most likely could be on your test. One could be lithium, one can be Depakote, and one can be SSRIs. Okay, 2 medications in one class, SSRIs. So to whom are you going to prescribe lithium? If the question says anger, self-harm, irritability, lithium. Now, borderline patients, they are depressed, emotional liability, right? Labile. So that is when you go to Depakote and not SSRI. Interpersonal problems, rejections, aggression, maybe some hostility, which is a bit different than self-harm and anger. It's a little bit less. Depakote is a great choice. Now, the same question, but I didn't say emotional labile. It says depressed, anxious. Now you go to Zoloft, Prozac, SSRIs. So I wanted to make that distinguish because it can be very tricky. Which one do you pick here? So self-harm, breaking things, anger, lithium. Now, if it's hostile, aggressive, but it's more of an interpersonal problems, more of if it says mood labile, Depakote. And if the question says the same patient, but it only says about being depressed and anxious, SSRIs. Zoloft, Prozac, don't care. Okay, so good 3 answers. I mean, it can only be one answer, but depending on what the question asks you, it could be different answers. Okay, but if the depressed, well, you can do Seroquel. You're not wrong if doing Seroquel at all.
But which behaviors though?
Well, you know, there'll be more towards of more of insomnia, more towards of depressed. Remember Depakote, I mean Seroquel, in my course I have like little bear, big bear, middle bear, and big bear, meaning that the little bear I use for insomnia, and then then you have the middle bear more depressed, and the big bear will be the mania. I wish I had that picture because it's very powerful, right? I had a patient that had not slept, quote unquote, in 20 years. She did sleep, right? But like she said, hey, I haven't been able to, I only sleep 4 hours, 3 hours. And then I give her 25 of Seroquel, and she's like, "Oh my God, this has changed my entire life." Right? I only give her for a period of certain time, 15 days or something. Right? So very powerful. Right? So it really depends. But for the test, I really care about lithium, Depakote, SSRIs, lithium, self-harm behavior, Depakote, more of aggression, more libile, mood, and if the question is more towards depressive symptoms, then it would be Zoloft, Prozac, of those kind. Now, few more questions here. Benna, do you remember?
I have a question.
Go ahead,
on that.
please. Go ahead, Kate.
Would the test question have like lamictal, olanzapine, Latuda in the same?
Probably not, because
option?
none of them would be incorrect, right?
Right.
Especially if you're targeting. And just an FYI kind of thing. How do I treat my patients with bipolar, right? I always treat them with upper and down approach, which I call them. The down approach would be a lamotrigine, and the upper approach would be for one of those that you mentioned, whether Seroquel preferably, or Abilify, or something along this line, right? I do an SGA plus a mood stabilizer, cover them up for the mania and low for the depressive mood. So, all right, we'll keep on moving because we got a lot to cover.
Sir, excuse me. The question will be coming this way. Patients with bipolar, what therapy we are going to give? That question's answer will be DBT.
Yeah.
Then, those way only mainly questions are coming. Another thing, the question will be asking what they will tell, what we will tell them to do, and journaling.
Oh, journaling.
Yeah, those kind of types of questions are definitely going to come.
Those are rapid recall, right? The questions will come a lot more complex. But if you can remember the active recall, you'll be able to get the question correct, right? So this is what we
active recall. I'm sorry.
Yeah, well, what we practice right now is active recall. Is what we learned in a simpler format. So if we know the simpler format, when we get a question that's more complicated, we can induce or conclude from what we learned what will be the right answer, regardless of how the question presents. As long as we are able to recall what we learned, and that's why I'm creating a sheet for each. I'm taking a while because it's a long hours of work. For each module, I'm creating a new sheet so you can actively recall. Exactly what I'm doing here, I'm going to ask you questions for each of the modules, right? So it might be over 2,000 questions, but it's simple questions like, let's say, pick somebody else real quick here because I don't want to make this a super big class either, right? Let's say, who did I pick? I can't pick myself here. So let's see who else. Let's say, Bridget. Hi. Are you there? You've been quiet.
I'm here.
So, okay. All right. Okay. I was gonna say someone with a name very, very similar to yours just passed this week. Her name was Bridget Valerie. So anyways, can you tell me about schizoid personality?
It's another one that they are really isolated.
Yes, I love it. Yes. Social isolation is the main thing, right? They are cold and detached.
Yeah.
So very good, right? Do you remember how are they different than the schizotypal?
Schizotypal is the one that is like magical.
Yes. Magical thinking, foiled, it's very weird, right?
Yeah.
What can you remember about avoidant personality disorder?
Avoidance is when they're scared to be in the public domain.
Okay, perfect. So the fear of criticism, disapproval, and rejection. Perfect. Just be careful because that also appears to be a little bit of narcissistic in a sense that narcissistic, oh, I'm the best thing ever. You know, how dare you to say that my work is not the best, right? So that's how they feel. And that sounds like avoidance too. They fear the criticism and disapproval and the rejection. But just read into the question. So don't read into the question. Read the question in order to really get a sense of what might be.
Question.
Schizotypal.
I have a
Go
question.
ahead, please.
For the avoidant, what type of questions would you ask that person? Open-ended, closed-ended, how?
I wouldn't say that would be a question on the test, just
It
because.
wouldn't be?
Yeah, I wouldn't think so. But like in real life, I
Uh-huh.
would keep it simple, right? Because they're already avoiding things. I would gain trust first. Once I'm able to gain trust, then I can talk about intimacy. I can talk about all the things. But until I get there, it's all about basics, right? And how we gain trust
Okay.
by being there for the patient, and takes time, right? Everyone is different. Some people gain trust on the first day. Some people, it might take 3 or 4 sections, right? And some people might even more than it. But I think the the better way of asking the question is for those with traumatic conditions in children. Then the answer would be more like a close-ended question.
Okay, gotcha.
Okay. All right, Betty, what questions do you have?
Yes, there is this question that I come across always, and I said, let me ask. It said, which of the following tools always includes an assessment for amnesia following a drinking episode? So, number 1 is RAPS4. Number 2, patient review. Number 3, CAGE. Number 4, family or provider. So when I took CAGE, it was wrong.
Okay. So what are you assessing for? What's the core of the question?
Amnesia. So it's amnesia. So the answer is saying,
go ahead. What's the answer? Oh my God, I kind of went blank. What? Oh, did I lose you? No.
I think
Hello.
unable to yes.
What is the answers again?
The answers are number 1 is patient interview. Number 2, CAGE. Number 3,
CAGE. Okay, CAGE.
family. So I took CAGE, but I was wrong.
No. Okay. So hold on. You took CAGE, and you assessed for amnesia. Why would?
No, it's the drunkenness that made me to follow.
No. But okay, let's go back to CAGE. So few things about CAGE. CAGE, you need to know. Let's go to the basic. CAGE. What CAGE is by the letter stand for? You need to know this. What's CAGE? C. What is C?
Cut down.
C is
Cut down. A.
Annoyed.
Annoyed. You annoy others, or others annoying you?
Others annoy you.
Others annoying you.
Oh, perfect. I usually get this wrong myself all the time. So, G.
Guilt.
And I mean,
I
open. So perfect. So we use CAGE to measure if someone will be a positive for alcohol, and that would be a number of
2.
2. So that in that case, we'll be like, okay, it'll be indicative. Then we could do other tools like audit tools to get a better sense. So that wouldn't make. I can see why you would go for CAGE, but the mistake that you made here is going for something that's familiar and related instead of really thinking through it, because you know this, you got the knowledge, but you fell into the trap of falling to the easiest path of resistance because you knew about it, right?
Okay, the RAPS4 is RAPS4.
RAPS4.
4, yes, S4. RAPS4 is the Rapid Alcohol Problem Screen.
Okay.
It has 4 questions too. And it has remorse, amnesia, performance, and eye opener.
I saw that somewhere. Yeah.
Is that
that's actually a very very hard question, right? But yes, that'll be because it has amnesia.
Amnesia, yes.
Yeah. So the rapid alcohol test also, so it's a quick test. It can be. It does have the amnesia, the RAPS, right? So RAPS. So rapid alcohol problem screen. So it's a set of questions, and then you do it for people that are risk with alcohol, and there are versions of that as well as in the RAPS4, right? Which is screening for quick and easy to determine if there is a clinical problem. So that would be a better one, right? Out of the answer choices. But I really like a clinical interview. It was one of the options too, right?
Yes.
The only problem here is that it's how would I say? This is more of a subjective than objective, right? So for that reason, Rapids 4 would be the best one, but in reality, in practice, I would go for clinical interview. But anyways, so thanks for sharing that, guys. I do not want to make this super super long. Otherwise, we'll be here all night long. Next week, after module 5, we'll do more of this. Okay, so just more like the one-on-ones, but in group. I'll ask questions. You don't have to answer. You can always call a friend, and but we just want to be able to recall. The reason for this is to recall. Rob, you have a question there? Oh no.
Yes.
Okay.
Thank you so much.
Go ahead.
Thank you so much for asking. I had a question about the cow score. Since we're talking about scales, you said you start pharmacological treatment at a score of 5.
Okay.
And I don't remember which medicine that you use. If it was buprenorphine or if it was
all right.
naloxone.
Who can help me out?
I can help you.
Thank you. Please help me.
I can help.
Go ahead. First person that said
Clonidine.
clonidine. Okay, so you
Yeah.
start clonidine, and now my score is let's say 8, 9. Let's say my score has jumped to 9.
Okay, clonidine.
Hold on, guys. Let her answer. Finish one thought advice. So we start clonidine because the person. Well, let's go back. COWS. What COWS stands for?
Clinical opioid withdrawal symptoms.
Perfect. Do not use COWS. Do not confuse COWS with SEWA. What SEWA is used for?
Alcohol, right?
Alcohol. So that's the first point. I have seen 1 or 2 people. COWS. Let's not do that anymore. Learn from that mistake. So now we do opioids. We got the COWS. We did the COWS score, and the score was a. Then we can give clonidine. Now the score is a 13. What other 2 medications can we give? Well, we should give instead of clonidine.
Suboxone.
Oh, buprenorphine.
Isn't that the same thing?
So we can do Suboxone or buprenorphine. Yeah, and we can also do methadone, but preferably not because of cardiac complications. Okay, so now we decide to do that. So these are the two other possible medications that we can do that. Now let's go back to you, since you asked about cows, Rob. So what SEWA stands for?
Oh,
I think it's clinical.
Let him answer, please.
I can't remember this.
No problem. Somebody help him out, please.
Clinical Institute Withdrawal.
Assessment for alcohol. Perfect. So let's talk about SEWA. When do you start the treatment for SEWA? What number?
8.
8. All right. So you start at 8. What 2 medications can you think of? Well, there are more than 2, so this wouldn't be correct to say 2. But can you think of that we talked about? SEWA. 8. Okay. So lorazepam, Ativan. Right? So yeah. Now, do you give that PRN or schedule?
PRN.
PRN. At what number do you give it a schedule?
16.
10 to 14.
15.
13 to 24.
15 to
I'm
24.
sorry.
Okay. So right there at 15, now we are going to give a PRN plus schedule. Okay. Now, which one would you give if someone has a liver compromise?
Level of
Lorazepam. L for loves the liver. Okay. So these are details that we kind of really need to get them right and not confused. And the earlier we practice, the better we get together. All right. So my camera went out. I am super apologetic for that. It's probably time to go. But I'll see you guys again next Friday. All right.
Thank you so much. Good
Thank
night.
you so much.
Thank
I
you.
love,
Thank you.
Doctor, I love your puppy. What's your puppy's name?
Oh, Lola. That's Lola.
Lola?
Yep.
It's a girl?
Yeah, it's a girl.
She's gorgeous.
Thank you.
Yeah,
Thank
she
you.
is.
Appreciate that. All right, guys. Good night. Thank you for coming
I
here
have
today.
I have one question.
Go ahead, please.
You had this rapid fire on YouTube. What's the link?
Oh,
could
I have
you
no
put
idea.
it? Can you put
Yeah.
it in the
let me
chat?
find the YouTube channel. I
can you-
have my right man that does all this stuff for me.
Yeah.
YouTube.
Can you put it in the WhatsApp
Yeah.
chat?
So I
pull it
am
up
going
from
to
there.
do
I love this.
yeah, I'm going to do the YouTube channel. Oh, and then you guys look at it, give it a like, give it a comment. I appreciate that. It helps him. The more people that likes it, he makes more money. So, I help him out.
Dr.
Yeah, he was.
Lopez, that's how I found you on YouTube.
Oh, really? Yeah.
Yeah. I said, oh my gosh, no, I need to go. I need to go.
Yoo-hoo, yes.
Yeah.
Yeah. Basically, I have a team that works with me, and the more people sign up for my channel, likes my video, he makes more money, and I'm happy for him. He's a very good guy. He helps me out all the time when they have website issues. So go ahead and give it a like for him, and they'll pay him some more money.
Right.
There is no money that can pay the right people. I'll tell you this
Right.
right now.
That's
He
true.
helped me out. So
How long was the rapid fire? How
it
many
was
minutes?
it was actually, I have to say about that because I talked to Lisa and I woke up at 5 in the morning to help her out, because they're like, oh my God, I'm testing 2 days and I was only on vacation. And then she called me and then she was kind of in distress and she scored 63 on her diagnosed test too. And I'm like, oh my God, this is really cutting close. So I said, well, I'll meet with you 5 o'clock in the morning, my time, the day before the test. So we kind of just went over this type of questions that we just did now, just like, and she's struggling, right? But it worked. And then she just passed the board, but it was that cutting close. And I was like, oh my God, this why it's like, I make no measurements from my end to help you. But sometimes I'm not humanly possible because I only have 24 hours a day. But if I possibly can, I'll wake up at 3 in the morning, 2 in the morning. As long as you pass, guys, as long as you do your part, I am there for you too. So,
but how long was it? How long was
it was probably like maybe 2 hours, maybe an hour. I don't even remember.
I think it was an hour and 15 minutes. I just shared it in the WhatsApp. I just shared it in WhatsApp.
Did you record it?
Yeah, it's recorded. It's on the YouTube.
Really?
Yeah.
I'm gonna go there. All right. Thank you.
Thank you. You guys have a good one.
And
I'll see you guys.
The link is in the WhatsApp. Is that correct?
Oh yeah. Rob just shared the link.
I just shared it. I think I just shared it.
I gave my number yesterday to put in the WhatsApp. Can you send me to? I'm not in the WhatsApp group.
Please,
I give my number.
Text me. Okay. WhatsApp me. Don't text me because I do not get the text. WhatsApp is 808-230-7858. And then I'll go ahead and make sure that you are in the course. You cannot join the course if you're not the WhatsApp. That's only for the people on the course. You are. I'm just saying this because my guy is going to upload this on YouTube. This is for you guys. So I try to protect you guys from
I'm on the course.
interruptions. Yeah, I know you are. So 808-230-7858.
Okay, good night, Dr. Lopez.
All right. Good night, guys.
Good night.
Bye-bye. Thank you
Good
for
night,
coming.
doctor. We'll get some rest. Thank you so much.
Thank you.
All right. Bye-bye.
Thank you, Dr. Lopez.